Well, in today's senior segment, Dr. Bodo Brauer joins us to discuss a very important but sensitive issue, bladder problems.
Yes, very sensitive issue. And it affects mostly women. Men are not immune.
Yeah.
And leaking bladders, the medical term is incontinence. And there are basically two major types. One is called urge incontinence. That's the one where when you feel you gotta go, it's too late. The other one is called stress incontinence. Coughing, sneezing, laughing, and the bladder opens a little bit. And these folks, and this is very, very embarrassing.
Yeah.
It slows them down. You know, you don't want to go shopping to the mall because you're worried that every time you sneeze, all of a sudden here comes the accident.
Yeah.
Also, folks don't want to talk about it with their doctor. So I encourage everybody, talk to your physician or your EPO physician and say, look, doc, I got a leaking problem because there is medication that we can use to fix this. And if push comes to shove, there are surgical procedures that can correct this.
That's what I was going to ask. So what are some of the medication, what are some of the things that are available for people who are dealing with this?
There's nothing really over the counter.
Okay.
These are all prescription medications that act on the bladder muscle and make it less susceptible to be, you know, overactive and shut this down a little bit. Men are also affected by this, and this is usually in response to enlargement of the prostate, but mostly women. And the more kids they had, the bigger the problem gets.
Really?
Yeah, because you know, with multiple childbirth, everything just kind of drops and sags a little bit, and all the pressures are off and nothing works. But please talk to us. Talk to us. It's important. Your life can change for the better.
Exactly, and it'll be more comfortable to go out and do different things, and you know, going to your doctor. I mean, it's just have that open communication.
There's really, once you're sitting behind closed doors with your doctor, there's really nothing you shouldn't be able to talk about, whatever the problem is, and we're in tune to it, and we can help. So I encourage everybody who's got a leaking problem, let's stop the leak.
Now, let's talk a little bit about, I've heard of situations where people's bladders, they're not going to the restroom. What are there ways, what should you be concerned about when you can't go?
Well, that's a different story. That's a different story. This, you know, it's called acute urinary retention, where it just doesn't open up. And there can be, you know, a lot of reasons for that. If that happens, first of all, if you can't go, male or female, that is a medical emergency. If you feel that you've got to go and nothing works, go to the emergency room, because then we can relieve the bladder with a catheter, and then find out what the reason behind it is, because there is a secondary reason behind this. This doesn't just happen out of the blue.
All right. Well, Dr. Bodo, thank you, Brauer. Thank you so much for joining us. Great information to know.